Hello, my name is Dr. Pauwlina Cyca. I'm the Senior Advisor of Pharmacy Services for Pharmacy Brands Canada. I'm also a pharmacist and a resident physician in the family medicine program here in Alberta. We know that pharmacists are equipped to fill the gap in access to primary care. We know, however, that it's not as simple as hanging out a new sign or adding additional work to an already full plate. That's why at Pharmacy Brands Canada, we've created a robust toolkit of resources and support that extends beyond minor ailment treatment algorithms. Consolidating community pharmacy and clinical practice means a full redesign of your workflow, and that starts with triage. Let me show you. This is your drop-off counter. It's also your triage desk. This is where patients will present for a prescription to be filled, but they also may present for an assessment for a minor ailment. We've created a standard operating procedure and a protocol to align with all of the other triage systems in the country that hospitals utilize. In doing so, you'll triage your patients according to priority, based on how acutely ill they are, or the severity of their illness and how quickly they may potentially deteriorate. Once your patient has provided the demographic information to your pharmacy team and their chief complaint, you can prioritize them appropriately and escort them to your therapeutic assessment room. Follow me. This is your therapeutic assessment room. This is where you'll conduct a focused clinical history, a best medication history, and probably a focused physical exam. To help guide you through this process, we've provided clinical cards. Each of these cards are specific to a unique minor ailment. It takes you through the history of presenting illness and pertinent questions to ask your patient, the focused physical exam, a treatment approach, investigations you may want to consider, as well as a follow-up plan. These cards are the same cards that are utilized by family medicine physicians across the country. We realize that the focused physical exam is probably not something you're accustomed to utilizing in your community pharmacy practice right now. So we've introduced workshops and one-on-one coaching to help you become comfortable with a physical exam. We also realize that should you identify a red flag during your assessment with your patient, making this minor ailment no longer so minor, we've covered you there too. We have preferred provider agreements with primary care consultants who are at your fingertips in real time. You can consult with them about your patient's case. You may decide together that you can continue to treat your patient here with you, or you may decide to transfer care virtually, or you may decide that they need a more acute attention at an urgent care facility or hospital. Either way, you've done your due diligence and you've practiced within your scope. We also realize that you require engineered, road-tested, and innovative technological solutions to keep your workflow running smoothly. So we have IT partners that have provided us with solutions to help you document your patient encounter and write your prescription in a single step. Once you prepare that documentation, in real time it's disseminated into your pharmacy software so that your pharmacy team can prepare the prescription for your patient while you continue to counsel them and close the encounter. We have a dedicated design team. They're experienced in providing smooth floor plans so that your workflow is streamlined and that you realize your vision for your pharmacy clinic. We have a dedicated marketing team just for you so that you can create your own brand and realize your own vision. They can provide all of the marketing assets and even run your social media for you. If all of this sounds interesting, intriguing, or hopefully exciting, I would encourage you to visit our website for more information, or better yet, reach out directly. Any of us on the senior leadership would be really happy to discuss the opportunities with you. You've been trained clinically. Let us help you practice that way.